It's a beautiful sunny day here in Oakland, and today I want to share about laser hair removal surgery. I've had 2 sessions so far, and it's been about 2 weeks since the second one, and I'm feeling really good. So contrary to the thumbnail, I didn't get lightly grazed with a lightsaber, even though that would be cool. I was really excited to get started, so I wanted to get laser hair removal because I will be able to travel internationally more comfortably, won't have to shave in the mornings. It's really like the only thing I really want to do surgery-wise, at least right now. It gives me a lot of dysphoria. Anyway, I'm really excited and a little nervous. So, a little breakdown of laser hair removal surgery. In my case, I need to have my hormones in cis-female ranges before I could even qualify for this. My copay is like $15-20, which it takes about a year, or 4 to 6 weeks apart. It's gonna take just over a year for me. To be clear, it takes 6 to 8 weeks because you have to wait for the hair growth cycles to fully do their thing. You can't just shave everything off because different hair has different growth cycles. They told me that the goal was around 80% removal, and each session would remove 20% of the hair. The whole session, each one actually only takes about 15 minutes. And each session, the intensity would go up 2 joules. I started at 10 joules, then I went up till 12, and then 14. So if you think of it proportionately, each time the percentage of pain, the percentage of intensity gets smaller relative to where you were. So it really isn't that bad. Before you get your laser hair treatment, you shave or clip your hair in the area to be lasered 24 to 48 hours before treatment. The shorter the hair, the better for laser treatment. Once I did it literally I want to say an hour, 40 minutes maybe before. The other time I did it a few hours before. My tech said you could do it the night before. And then 4 to 6 weeks before your appointment, it's important to stop plucking, waxing, and the use of depilatories or bleaching agents, so like laser hair removal cream and waxing the face. Wasn't something I did, so that was nice. Number 3, like I mentioned earlier, it says do not tan at least 6 weeks prior to laser treatment. This includes a tanning bed and booth, facial tanning, creams and sprays. Tanned skin cannot be treated, unfortunately. 4. On the areas to be treated, please stop using products that contain acids, for example, retinol, oil, gelatin, glycol acid, a week before treatment, and then 3 days after you can resume. So just check the ingredients on your skincare products. Number 5, please let your nurse know if you get any sores or open lesions on the areas to be treated, history of light-induced seizures, or upcoming surgeries. No laser treatments 6 weeks before surgery. So that's that. I want to share a little bit about the first session. I'm about to go get laser hair removal. It's a little scary, but I've been wanting it for a really long time. You know how it goes. The first session, it went pretty well, and I didn't get any sores or bumps afterwards. It was a little red, but my tech always gives me something I need to buy, which is a tinted sunscreen, which just kind of covered up a little bit of redness I had. And then I put on my sunglasses, mask, a hat, just to really protect myself. Just had my session. Honestly, it didn't hurt as much as I thought it would. The air tickled, hiding from the sun. I thought it hurt a lot more. So it wasn't that bad, honestly, which is really great. I'll have to show you when I'm home how my skin looks. And I didn't even use numbing cream, so next time it'll be better. I didn't notice, understandably, how great it felt until 2 weeks later when all those little hair follicles fell out. And I remember I woke up one morning. I think I have some pictures. I'll try to find some pictures from around then and insert them here. I was like, did I shave already? I hadn't shaved, but I could notice I had less hair on my face, which was really great, really gender affirming. Taking care of your skin is really important. My lab tech recommended a sunscreen that has zinc, mineral-based, and I like this one because it doesn't leave a white cast from my brown skin. So, session number 2. I, again, am not great at getting stuff done beforehand. I was rushing late, ended up having to take a lift all the way there. I tend to be late. Something I'm working on. Anyhow, for this session, I had some off-the-shelf numbing cream. I'll put a picture of it right here. However, I was supposedly prescribed one. I still have yet to see it, so I'm going to have to contact my tech and be like, hey, where is it? The thing is that since I was rushing late, I was in the back of the lift, and then I thought, I should put it on. I kind of remembered my lab tech saying something about for numbing cream to work, you have to really put it on like frosting or an ice cream cake, we were joking. I only put a little bit on, so it has to be about 40 minutes before. So either, really cake it on, put on some plastic, line a mask in plastic and put it on. That's what I'll do next time. Kind of forgot. That was annoying. So now I want to go a little bit more in depth of how it actually felt. Number 2. It's pretty exciting. It didn't hurt that much. Okay, it hurt. It definitely hurt. But again, I thought it would hurt a lot more than it did. It really only hurt like here where it's going right up against the bone. Here around the lips is pretty painful. Before they do any laser, my lab tech would ice it down, and I even asked for extra ice once because I felt like it wasn't quite enough. But then like around here where there was some fat protecting and stuff, and even down here, it wasn't super painful, which was really nice to know. And then another thing to know is that I'm lucky because I have dark hair, so the laser can detect the hair more easily. If you have light hair, laser might not work for you. That's how it went, and this is my reaction directly after the last one. I just got out of session number 2. It hurt. Definitely hurt. Feels pretty good. 2 down, about 10 more sessions to go. I'd have the next one booked. Seeing the hairs go away just makes me so happy. So yeah, I was thinking about that. Even when it hurt, I was like, they're going. This is what I look like after 2 sessions. So if the math is going precise, I should be about 40% less facial hair. And I think I do notice it. Before, if I didn't shave for a day or 2, especially, I'd like get major dysphoria and there'd be hair everywhere. At the same time, my estrogen levels have been higher, and that definitely slows down hair growth. Obviously, I can't exactly tell. I know a lot of it's laser hair, but some of it might also be the estrogen. So just a combination. Point is, we're getting rid of the hair. So here's a little summary of what we talked about. Before you go to the session, you got to make sure you're not tanned. You got to shave before. You can't use any waxing or hair removal creams. And then let the clinician know, like obviously if there's any cuts or bruises, and no tanning. And then it's a good idea to put on numbing cream, cake it on like frosting 40 minutes before your session. During the session, the pain isn't as bad as you think it is, isn't as bad as I thought it was. Sometimes the shock of the air was more jarring and the smell of burning hair was more jarring. It really only hurts when it's near the bone and around the lips, when there's not a lot of fat protecting nerve endings. I can hold on to something and they'll ice your face as they go, so it's not that bad. You have your eyes covered. I did get a little panicky sometimes, but I just asked my lab tech to narrate everything, and that really helped. Afterwards, if there's any discomfort, they recommend lidocaine cream. They recommend LMX and Anna cream, and it says do not apply 45 minutes prior to treatment. Then after the session, let your doctor, your clinician know if you have any, your lab tech know if there's any bruises or lesions. I really didn't experience like a red puffy face like I heard some people have. 2 weeks later, you will actually get to see what the results were when the hairs fall out, and it takes about 6 weeks between each session, so it takes just over a year to do the face. Each session increases the joules twice per session, and each session should remove 20% of your hair. The goal of the full removal is 80%. There's not 100% guaranteed, and that's all. I'll keep you guys updated probably in a few more months when I've done a few more sessions. If you have any questions, feel free to let me know. Thanks so much for watching. I'll see you guys very soon. Don't forget to subscribe, leave a comment. Thank you for joining me on my journey. I'll see you guys very soon. Bye.